Welcome, friends. This is Mike Collins, Healthway Compounding Pharmacy. This is our provider spotlight. And today with me, I have Amy Kopis. Amy, tell us a little bit about what your practice is and where are you guys located at?
We're women's OB-GYN here in Saginaw, the top floor of the Covenant building. Our address is 5400 Mackinaw, Suite 6100 in Saginaw, Michigan.
Excellent. So tell me a little bit about the services, I guess, that you offer here. And now we know it's women's health, so that narrows it down somewhat. But
Sure.
but give us kind of a brief overview of what you have for providers-wise and what kind of services you offer.
Well, we currently have 5 physicians, Dr. Spence, Dr. Schmidt, Dr. Minnick, Dr. Wagner, and Dr. McEwen. Then there's 3 of us nurse practitioners, myself, Rhonda Ivan, and Maureen Smith, and 1 midwife, Kelly Hammis.
Excellent. So is there a difference between the providers as far as what types of care that they give or what kind of patients that they see?
No, actually, there's always someone here to take care of patients from the whole age spectrum of adolescence to advanced age.
Excellent. So now obviously you guys see pregnant patients. We think of that when we think of OBGYN, right? It's in the name.
Right.
So what other kinds of conditions might drive a young lady or even an older woman to come in and seek out an OBGYN, kind of maybe instead of or in place of their primary care physician?
Sure. Well, we definitely do well health exams. We provide all birth control services. We do menopausal treatment, especially with hormone therapy, like we get from your pharmacy.
Excellent.
Yep. Bladder evaluation and treatment. We do robotic surgeries, infertility, which is one of my specialties.
Perfect.
And we have a cutting edge research department also.
Excellent. That's great. That gives us a little bit of ammunition to really talk about some of our next things that we want to discuss on another one of our issues is infertility. So can you give us a little bit of teaser? What kind of things do patients come to see you for infertility wise?
Sure. I have been a certified infertility nurse for 5 years in the beginning of my practice. And in the past 20 years, I've been here at Women's OB-GYN as a women's health nurse practitioner. I would say 70% of my practice is the gynecology, but a good 30% is infertility.
Oh, that's perfect. Well, that sets us really good for our next little recording that we're going to make, and we're going to dive into a little bit more of the topic of infertility. So thank you, Amy, for being with us today.
Thank you. It's my
and
pleasure.
we will touch back bases with you. So live healthy, my friends.